Okay, here is your question, and I've started your timer. Right, so if you have read and understood, considering it communication skills station, kindly please begin.
Okay.
Yes, you'll pick the telephone if it's available and you'll start talking or
Okay. Hello.
yes,
Hi.
hello.
I am Ahmed Abdullah, STO, working for Mr. X.
Yes,
I'm calling to speak to Mr. X,
yes, speaking.
the consultant, to ask him about advice about any case.
Yes, can you please
Right.
summarize your case?
My case is a fragile lady who had a mastectomy with axillary clearance 2 days ago for breast cancer. Now
Okay.
she has an the patient need to the charge against medical advice with her daughter.
Okay. Why? What has happened? Why do the lady wants to go home?
I think her daughter has convinced her mother that it will be best for her to go home with her today. Although the
Okay.
patient would almost certainly prefer to go to her own house when she is when she is good enough to go home.
Okay. Have you tried to rule it out that patient is alert, sufficiently alert to make this decision?
Yes, she has the competency to make an informed decision.
Okay. So have you informed the patient what might happen if patient decides to leave for home now?
Sorry?
Have you informed the patient what can happen if patient decides to leave for home now?
Yes, I informed the patient and her daughter all the complication, and I had I spent 20 minutes trying unsuccessfully to persuade her daughter then that the charge today were not in the patient's best interest.
What is your plan of action now? What would you do?
I will ask. I will I will tell him again about all the complication again after discharging from the hospital, and I will tell them they will sign a legal document about the exact details about her health, and that they taking all the responsibility and adverse effect that will happen for her after discharging against medical advice, and I will explain to her all the sign and warning signs that to be alert for and to attend to the A&E once once she has anything of them.
Why patient is having shortness of breath?
Patient is OPD, maybe
Yes.
maybe a
Yes.
cause, maybe she is in acceleration.
Yes. Or
Also, also also the patient post-operative, maybe something post-operative like a pulmonary embolism or something like that.
pulmonary embolism or DVT, deep vein thrombosis,
Yes,
leading to pulmonary embolism. Have you done any X-ray or any investigation to rule that out?
I will check for you. I don't have this information. I will check for you, and I will give. I will let you updated later.
Okay. Can you tell me if the patient, if you decide to send the patient with the drains?
Yes, I will leave the drain for the patient.
Yes. What measures would you take?
Sorry,
What measures would you take when you'll send the patient home with the drains on?
I don't hear you, sorry.
What measures will you take when you're sending a patient with the drains on?
I
So
didn't get
the
it.
answer is you'll send the letter to the local GP. You'll inform the patient that she will be in contact with her local GP, and you'll also inform the social services,
Okay.
and nurse will be checking upon the patient. So when patient is ready for the removal of the drains, so local GP will go and take the drains out. Okay. So what are the complications that you have informed the patient about? What are the
Uh,
warning signs patient has to look out for?
as I as there is as for the patient,
Yes,
hemorrhage and continued bleeding from the drain may be one of the complications.
yes,
In
and
case shortening of the breast may lead to hypoxia and lead to lead to deterioration of the patient condition.
yes,
Also, if the patient is have a DVT and pulmonary embolism, this is a serious condition that may lead to her death.
yes. Have you informed all these red flags to the patient?
Yes,
What was patient's response to that?
the patient feels her daughter feels that her mother is good enough to go home.
Yes. And what was mother's reaction? She's also willing to go home.
The mother prefer go to her own house when she is well enough to go home, but her daughter convinced her to go home now.
Okay. How would the management of the patient differ if it's instead of mastectomy, patient underwent lumpectomy?
Sorry, sound
How
is
how would the patient's management will differ if patient instead of mastectomy here had undergone lumpectomy? Lumpectomy?
yes.
Yes.
I don't know this question.
Management will be simple. It will not be that complicated because mastectomy is removal of the whole gland, mammary gland, but lump is removal of a small lump, right? So management will be less.
Yes, yes.
It will not be as vast
Less
as it
invasive,
is.
yes. Yeah, I
So
got
there'll be less invasive, less, maybe you'll leave a drain or maybe not, depends upon the type of the tumor and the procedure or surgery performed. So it will be less invasive and less. All
Thank
right.
you.
What more would you do?
What
What more measures would you take for this patient? Patient is also having mild left ventricular failure.
Yes, for the patient, I will make some. If the patient is dead, I will contact his GP about her medication, her cardio medication,
Yes,
echo ECG. I
yes,
will order echo ECG for the patient.
yes.
Also, I will order full platelet count to check hemoglobin for the patient, as the patient is a drain, was which was a drain, which was active drain.
Yes.
Maybe which would suggest continuing bleeding.
All right. Can you tell me when should the drains be removed according to NHS guidelines?
I don't know.
What your logic says according to NHS guidelines?
When it's
When,
no longer drain any blood.
yes, how long would you wait? Or should you wait? Here, the question according to NHS guidelines is that the question is whether to put the drain or not, because when they are performing the procedure, so they decide that depending upon the type of the cancer or the tumor, they decide whether they should put the drains on or not, because the small amount of fluid body can absorb it itself. So putting a drain in and then leaving it when you know for at least 12, 24 hours, nothing comes, or how much
24 hours?
12 to 24, how much fluid would come or not come, then you have to
Yes.
decide
Okay.
to
This
remove
is new
the
information to me. Okay.
drain. So you would have to decide. First, they decide whether to leave it on or to remove it, and then you have to decide how active patient is bleeding or how actively it's needed. Otherwise, you can remove them.
Okay. Okay.
Small amount, 50, 60 ml, even 100, 200 ml, doesn't matter. Body can absorb it.
Okay. Okay. So it will be leave for 12 or 24 hours.
12 hours, nothing comes. A small amount comes, which even you can take the drain out. Doesn't matter, because
Okay.
they don't even prefer to put the drain in on the first place.
Thank you.
Thank you.